Hi, my name's Harry. I am a second year Masters student at the University of Cumbria, currently studying physiotherapy, and I am based with the Early Support Stroke Discharge team. So I've been asked to give a brief video about what to expect when coming on placement. So whether you're coming here as an occupational therapy student or a physiotherapy student, you're going to have the opportunity to work with some fantastic educators who are not only very knowledgeable about the field and about the subject, but they're also extremely good teachers in the way that they lead students to think for themselves, they question the students appropriately, and they coach the students to come up with solutions to problems themselves. What to expect as a student? Well, working in early support stroke discharge, you're generally working with patients who have been discharged from the acute setting, but they need ongoing intense rehab in order to regain full function. So as an OT student, looking at productivity, leisure and self-care, essentially looking at the person themselves, the environment and occupation. You're going to be responsible for adapting and setting expectations. As some patients might have extremely high or extremely low expectations, you're going to have to both help set and adapt those. You're going to have to do occupational analysis of patients within the home environment. You're going to have to be involved with goal setting for mood, as well as well-being support and ongoing rehabilitation. You're going to be able to get involved with both visual and cognitive rehabilitation strategies and upper limb and repetitive task practice for patient occupations. You'll also be heavily involved with tasks around the household, and with stroke patients they all present differently, so whatever you're looking at, whatever tasks you're looking at, you're going to have to be able to adapt those specifically for that patient. One patient might have visual difficulties, one might have upper limb difficulties. You'll also be involved with sleep and fatigue management, as well as offering patients advice on driving and on work should they wish to return to these in the future. As a physiotherapy student, you can be involved in the entire life cycle of a patient's rehabilitation journey. From doing their initial assessment when they are discharged from hospital, you will be working with patients to set goals. You'll be involved in intense daily rehabilitation, working on specific weaknesses which you've identified, specific outcome measures at the start of their treatment, which you can then review later on. You'll be working both on your own and with your educator, but also with the rehabilitation assistants who consolidate home exercise programs and work in a wider role covering both physiotherapy, occupational therapy and speech and language. You get the opportunity to see patients improve weekly, which gives you an opportunity to adapt and progress home exercise programs, as well as look at developing a patient's rehab goals as and when they occur. You get to pull on MSK knowledge when looking into specific parts of a patient's journey, such as gait analysis, to really drill down on how to improve a patient's gait. You get to use innovative stroke rehabilitation strategies such as constraint-induced movement therapy, which can be highly beneficial for patients who have reduced use of an upper limb, and this can help them regain that full function. You also get to be creative with your rehabilitation strategies and ideas. You have the ability to do your own further reading and further research and come into the placement with ideas and suggestions. Every patient that you see could have suffered a different type of stroke, affecting their motor control differently. Each patient might have their own goal, whether that be to get back to dancing, or whether it be to get back to driving, or whether it just be to get back to work. Whatever it is that they do, you're going to have to be able to be creative in a way that you can allow them to function at the best of their ability. Everybody's goals and everybody's rehab journey is different. You also get the opportunity to take on spoke days, such as working with speech and language, working more in depth with occupational therapy, and you also get the opportunity to see patients in an acute setting over at the Cumberland Infirmary on Hazu and Elmay. You get the opportunity to take part and lead in the stroke rehabilitation group classes. You also get the opportunity to lead on specific patients and manage your own caseload and own diary, inclusive of booking in patient appointments for patients that you've seen with other team members as and when you think they're necessary. This allows you to really build on your organisational skills for when you graduate to operating within the workplace rather than as a student. While there are great opportunities to learn and develop and practice new skills on this placement. It's also a great opportunity to work independently as a physiotherapy student. If you're based at Penrith like I am, you'll also get the opportunity to work with a neuro team 2 days a week, which is a fantastic opportunity to get a much wider experience of other neuro conditions, including MS, Parkinson's, motor neurons disease, traumatic brain injuries, and a number of other conditions, which is a really good opportunity to expand your neuro knowledge past that of just stroke. All in all, it's a fantastic placement. The information which you get given as pre-reading material is extremely beneficial, but it's certainly a placement where you can really thrive if you're willing to put in the effort to expand your own knowledge in your own time and read further around the subject, and you're able to come in and have in-depth and creative discussions with your educators about different treatment methods which you've researched, or about different ideas which you've had as well. So yeah, thumbs up from me.